Students and youth working on reproductive health action team Say What is a public health institution that works with students and youth in tertiary institutions on their sexual and reproductive health issues and to enhance their capacity to lead healthy lives. The advent of the COVID-19 in 2020 affected young people, especially those going to school, greatly. The deadly coronavirus has hit the whole world hard, infecting, affecting, and killing many people. This has forced many countries to enforce national lockdowns in order to contain the spread of this deadly virus. Say What went around the country of Zimbabwe to find out how young people in tertiary institutions were coping with the pandemic. Say What has created a platform for young people across Zimbabwe to speak out firsthand on the challenges they faced in dealing with COVID-19.
The very first time I heard about COVID-19 was, I think it was in January last year. My uncle was telling me about it, and then he was saying that in China there's an outbreak of a virus, and I just probably thought that it would end in China. But very soon the virus got to Europe, and then Europeans acted swiftly, and then the lockdown was put on them, and there was the whole panic buying, tissues running out of stores, and I never thought that it was going to get to Africa. But by March it was already here in Africa, and we had the lockdown. We had to close schools early, and I was really scared. I thought that we were going to die.
The first days of the lockdown, I was farm in Prangamel. After the 21 days, I was here in Zimbabwe Park. You don't know what's happening. You don't know what COVID-19 is. Unlike malaria, cholera, AIDS, we got a chance to be taught what are those diseases, what are they about, what are the effects, how do you contract them. But with COVID-19, it was just sudden. There was uncertainty, I would say. Well, you'd have academic plans, right? To say that in 2023 I should be at the stage doing ABCD. But with COVID-19 now, like I said, there was uncertainty. You weren't sure if you were going to complete your studies at that certain stage, or there was going to be an extinction. You weren't sure of what was happening. So the lecturers had the expectations to say you're supposed to submit essays on this date. Right, but then I was Kufam, and there's no electricity there, and the network is down. You have no textbooks, there is no network, and yet there is an assignment that you are expected to submit by a certain date. Coming to social life, I lost my dad on the 23rd of March, right? There was nowhere we would, gather for more than 3 days, and people were actually scared, there is COVID-19. And soon after he passed on, the lockdown was announced. So people had to vacate. It was just confusion.
The pandemic brought a lot of uncertainty and adverse effects to many young people in different areas of their lives.
When the lockdown was introduced, I was at home, Harare. Well, at that time, I felt nothing at all. I thought it was something that was a bit far-fetched. I wasn't really understanding the impact that COVID would have on us. At college life, it was really quite a major drawback for me, because I wasted, or rather didn't learn for about 11 months, and that will mean that I'll finish my 4-year degree in something like 5 years. So we've only got to learn online just in November. Since December last year, I wasn't really active on Facebook and Instagram, but due to the lockdown, I found myself creating my own pages and being active. I didn't really receive any support. I only got help from my parents, since they are the breadwinners. We had to cope with what we had.
When the lockdown was introduced, I was actually at school. So we were told to pack our belongings and we needed to go home. So firstly, initially I felt relieved, because there was already a scare that a few pseudo-news that individuals had been infected by the virus. So I was anticipating going home. But then when we went home, we then realized that people were losing jobs, and also staying at home itself wasn't something that was good for my mental health as an individual, because you don't want to be idle when you are in your 20s. You want to be doing something, and it's frustrating to feel so useless, to feel so powerless and knowing that you just have to stay indoors and not doing anything, and still wonder where you're going to get your next meal, and still wonder if you're ever going to go to school and finish, so that at least you find a job and start helping at home. At this present moment, priority should be placed on students' mental health. I'll take for instance on how certain institutions have opened on short notice. Certain institutions have not considered how our parents are unemployed, or how some of them are civil servants and they are still finding it hard to raise money for fees, but still will find institutions opening at short notice.
I wanted to be in Blair. I had to be locked down in Harare. Frankly speaking, the lockdown at first, it was a bit harsh in that I still had lectures going on. So trying to adapt to the online learning, it was just a milestone for me. You know, like our data bundle, they're not reliable. You have to buy weekly bundles 3 times a week. I'm that kind of a person who finds it difficult to stay at home. I'm more of an extrovert. I'm not an introvert. So I would love to go out, have fun and stuff like that. So being on the lockdown, life was a bit complicated for me. But however, I had to make the best out of it. And also it gave me an opportunity to get to know my family at another level. I'm a science student. I'm supposed to be hands-on on the ground. I have good practicals that I'm supposed to be taking. And I can say that I was greatly affected in that, reading a practical is never easy. Doing mathematics and other stuff over the phone, it's not good. And it's never easy. When it comes to support, I can say that I received moral support from my family. So basically, just for future, as institution, as people from tertiary institutions, we should now start to adopt to the online learning. It's now a mandatory that each and every institution is supposed to develop platforms that are stable, and if possible, our network providers, they are not stable here in Zimbabwe. So it will be better if we try to have a certain agreement with them, so that they can also subsidize the data bundles, because we do not come from stable backgrounds and we are not the same. We have got other people that come from rural areas, we've got other people that come from the remote, the CBDs and stuff like that. So the network connectivity is very different. Someone would have to travel miles and miles just to get network connection. And also, I think it's now high time that health education become a key concept, not in each and every institution. We just, for my institution, we learn health education at first year, first semester, or first year, second semester. But what do we do afterwards?
The effects of COVID-19 pandemic have worsened the inequalities amongst different classes of people and risks reducing the productive potential of young people across the globe.
So when the lockdown was initiated, I was actually at school, because that was during March. So we were actually at school trying to figure out what we were going to do with our semester. So when it was introduced, it was a bit of disruption to all of us, because we didn't expect that, and we never thought that we were going to be sent back home. So we didn't want that situation. We tried to avoid it, but it got to us anyway, so we were really affected. So I got my emotions were so much affected, because of course, as a person living with diabetes, you have to manage, of course, this is the lockdown. You're no longer allowed to go out. You're no longer allowed to do the regular checkup that you'd have to do, the exercise that you have to do. So it affected us in a way that we are no longer have to do the things that we used to do, the routine that we used to operate in. So of course, the lockdown, it was really something else that affected people greatly. We used to do our lessons at school, we'd have to do discussions, we'd have to do in classes at school, but now because of the lockdown, we were now supposed to do everything online, of course, but buying bundles, it was really a challenge for other people. It was all online on social media, so of course, everything was now being reduced to online. The COVID-19, I would say, it's brought families together. So now there was a huge bond between families. For activities, I now have to do gardening at home just to make sure that I'm super active, because with COVID-19 and living with diabetes as well, so you'd have to manage to make sure that you're not just eating and sitting down. So of course, I had to do a lot of stuff. So many compromises were made. thanks to our government, they introduced a system where people living with conditions, they had to go to the pharmacist. When they produce that they have a condition, they need to buy medication. So they would have to go there and do the things that they have to do. If people are to be allowed to pay half of the fees and use half of the payment to buy bundles for themselves to support, because of course we now have to do online things. Of course, if people are going to be home, they don't have to pay full fees. They have to pay half of it, and then half of it can support them on their online lessons, rather than to have schools tell you that we're going to give you bundles and then bundles do not come. So I think that would have to be factored in just to see how we coped with the last situation, and if our government or if our institutions can cope from those schools that are abroad, to see how they're doing it and stuff like that. So then of course this is a change. This is a thing that we have to take in ourselves. It's nobody brought it up, but of course it has affected us, so we now have to know what to do and how to do it.
When the lockdown was imposed, I was at home. When the lockdown was introduced, I was disappointed in the sense that my business was affected because I rely on my business. I usually support my family in the sense that I'm a hustler. I do a lot of things. Pa business rangu, randoita, I rely mostly pa my students. So when the lockdown was introduced, it was affected a lot. And also, my education was also disturbed in the sense that we are now educating under pressure. We are no longer engaging in normal semesters. I think for students, to support them, we should introduce projects to them, supporting them financially.
Besides academic-related challenges, COVID-19 and the lockdown also presented students with serious challenges in accessing sexual reproductive health services, which they used to access freely in their various campuses. Lydia Mutumbu, who was staying at her parents' farm, had this to say.
And another thing that I also went through when I was co-farm, right, is I noticed that sexual health services, it's difficult to get access to them. And we're still with the lockdown, those are critical services. You come to the conclusion that I don't have a choice. And there's probably just one clinic 2 kilometers away, and everyone knows everyone. So if you go and get your loop checked, everyone knows that PDA has it open. I think that sexual health services are crucial. Whatever happens, whether there's COVID-19, whether there's cholera, the government, the people, everyone should find a way to make sure those services are provided. Because knowing students, they will never stop having sex because it's lockdown. They will never stop indulging.
Say What went to Motare to find out how young people were coping with the COVID-19 pandemic.
When the lockdown was imposed, I was at school. Well, I felt a lot of things at the same time. There was a little bit of hope that probably the virus will subside and we go back to our normal routines. But at the same time, I was full of anxiety because I didn't know what was going to happen to me academically, specifically, because at this stage, you would have planned so many things in your life, and then if something like this is imposed on you, you don't really know what will happen, and a lot of things will be disrupted. Talk of psychosocial support, we couldn't get to our friends. I go physically to them to gain that strength and support, because there are some other things that you wouldn't be able to probably talk to your family about, but I couldn't reach my friends for that support. Talk of school, everything was at a standstill. We didn't even know if we're going to continue, if we're going to finish our degrees. I didn't know what I was going to do, but I had to just sit and wait. And waiting was torture because I didn't know what will happen at the end of the day. To me, it was a time to self-reflect and introspect, strengthening the bond with family. I also made sure that I was in contact with my social circle. I did a lot of support coming from family. The mind was used to a certain way of doing things, and now that there is a new way, the mind needs to be prepared as well for that new way.
Although Fungai Chinjende has not been able to go to Manicaland State University of Applied Science during the lockdown, he had the privilege to visit Say What offices at Mutare Teachers College to get supplies of condoms and information education communication materials for colleagues in his neighborhood.
The lockdown was so devastating, and it affected us. It affected specifically, it affected me, because that time I was now geared up for my exams. So I felt so embarrassed by the situation. Tainguita Wi-Fi. Tichi started tichiona my life issues using Wi-Fi. So going back home where there is no Wi-Fi, where there is no internet, I think zvakatidzosa kumashure zvakanyanya. I think one thing which is very important, there is need to support young people and students. Zvaita sekunge my young people are not affected, of which we are the working class, we are the energetic generation.
When the lockdown was imposed, I was home. We were not going to school. Everything was just on standstill. It was something which was good for us because we didn't know that it was going to be that long. We thought it was something that was going to protect us against COVID-19. But then the moment that they started prolonging the lockdown, that's when we figured that everything was in despair and we didn't have hope. We didn't know what the future held, and that was just traumatizing to us, especially as students. Talking about school, we were really affected in the sense that we're not used to learning online. Secondly, we didn't have the infrastructure and the resources to work online. We didn't have the data. Data was expensive. We couldn't access internet, and it was something which was vital, which you couldn't get, and that was just traumatizing. And when it comes to friends, most of my friends, they do not stay in Mutare. During this lockdown, that's when I really got to be a person who was very social, especially on social media, because we had nothing else to do. Watched a lot of movies, and sometimes, yeah, we did books, we studied. Say what was always there to entertain us, talking to us, interacting with us in so many ways. They created WhatsApp groups where we got to talk with other students from other institutions. And yeah, that was the support that I can say we received. If something similar is to support students, I think we have to provide services such as creating, let's say, a school where students get to go someday, let's say on Monday, they can just go there and interact with each other. Of course, they will have to be screened for such disease and stuff so that they can also be there to help each other mentally. Because the moment that a person stays too long alone, that will affect their mental health.
In Mashingo, Say What spoke to youth and they shared their stories.
When the lockdown was first instituted, I was here in Mashingo. We already started our third year's first semester, so we were asked to take it like a brief. We just told to go home. We didn't know exactly the time frame, but we all assumed it was going to be for a week or 2 weeks, and then it seemingly didn't end, and then it became like a cycle of unending psychological trauma. Then with friends, we couldn't meet up. And it's not easy staying at home 24/7, not even going outside the gate, not even going to buy any groceries, just being there with your family, watching TV. It sort of starts suffocating you and become depressed. It's not a good feeling at all. When we were told to go home, we left our luggages, and then some of us were staying off res, so that means we had to continuously keep on paying rent even though we were not here. And then most of the parents were not like financially able to pay because some of them were like informally employed, and then the government was not allowing any informal, whether we were vendors and stuff.
In Gweru, young people faced an uncertain future.
Well, we had just opened for like 3 weeks at school, and then they told us that we're supposed to go back home. Initially, I just thought it was going to be like for a week or something because I didn't know how serious this coronavirus thing was. Well, personally, I'm a person who stays home most of the time, so I was just like, well, it's fine, I don't mind. But then the feelings started arising, like I want to be home at my own will, not to be forced to stay home. So we're just home, no communication, nothing. And then later on, that's when they were like, okay, you start online lessons. And then we had to do this over WhatsApp because most people complained we cannot learn on Google Classroom, we cannot learn on Zoom. So the only ones that we can actually try and afford are WhatsApp bundles. So we had to start having class online, and this was just a lot. So that was it. And then there was Say What organization. Well, for me, I was part of it. So there was a whole lot of group discussions, WhatsApp discussions, there were meetings, Facebook activities. So that really helped because they would invite people to come talk to us. Honestly, for some students, they still could not afford it. So I believe if provision was to be made for students like that, I don't know, log in with your registration number or something. People are used to functioning in groups. You know, sometimes you have friends in groups, and then now you cannot check up on each other as much. It's not every time that we have to keep things inside of us, because we don't know the impacts that this COVID can have, or lockdown actually can have on people. So if it's going to affect you as an individual, don't bottle it in. Speak to someone.
Yeah, when the lockdown was instituted, I was here at the campus. I felt so bad because I was first far from home, and then when we were here, we were not allowed to get out of the campus, so it was hard for us to survive. It was really hard for us because we couldn't get in touch with our friends. Even our school was also affected because we didn't learn in a normal semester. So those are the challenges we were facing. We were forced to be here on campus actually, so we couldn't travel. At least maybe a financial assistance could do. Yeah, I think the mental support is also important for us during this time of COVID-19.
Foreign students studying in different institutions in Zimbabwe were greatly affected by the COVID-19 lockdown, as they did not get any family or emotional support.
I'm from Congo. I was raised when the lockdown was imposed. Airport, road port, everything was closed, so there's no way possible for me to travel back home, so I had to stay on campus and try to do it myself. At first, it wasn't really a big deal for me, but when the lockdown kept on going, I wasn't willing to be socialized with people, so I was actually self-locked in my room. That was kind of hard for me to deal with, but then throughout the process I actually managed to come out of it. Well, from friends, yes, I did receive some support from friends, trying to motivate me to say like I should actually always grind. And for some of us, you know, we actually start away from our parents, and there's not any support to say like in terms of groceries and all. So basically, I would say just groceries and mental issue breakdown, like they should actually deal with that, trying to cooperate and trying to talk to them.
Say What met youths from Bulawayo who shared their uniquely touching stories.
When the lockdown was introduced, I was really disturbed because we couldn't continue with our education, so I was really disturbed academically. To be honest, I was used to the idea of my parents going to work, but during lockdown they were always there at home, and it was something that I wasn't used to. You know, waking up every morning, having to deal with your parents each and every day, it was really something else. During lockdown, I managed to copy the period by watching a lot of movies. I felt like it was the only time I could get to do what I didn't do when I was at school. I think students should be supported by the government, or should I say by the government, by providing learning resources for them.
At the time when I heard there was a lockdown, I was on attachment. So when it was imposed, we were actually doing a certain job which was out of Bulawayo. I was affected negatively and a little bit of positive by the effects of lockdown. Most of the things were related to school, because when I was on attachment, we didn't know if we were going to get assessed, how they were going to assess us. It was quite stressful, and I was budgeting on the legal incentive which I was getting on attachment. Like, I wanted to start a small company, so I needed to register it. It was hard, I won't lie to you. Actually, Say What happened to start a WhatsApp group which focused on the lockdown and COVID. And one problem which was the data was becoming expensive and always have a good signal. I think the students need is it psychological support, just to be encouraged, because even me at a certain point I was like, will I ever finish this degree? Because of lockdown, because it was 21 days, then it ended up in being 3 months, 4 months.
When lockdown was imposed, I was in Bulawayo at home. It was now 3 months after I closed. I was now looking forward to open, because I was supposed to open in April. Imagine you're looking forward, you're already bored by the already 3 months to be 4 months holiday. Now it's being an added more months. Yeah, it was very horrible news. According to my life plans, I'm now a year behind. I have to add a year or more because it's not already at school. Nothing has started, even the online issue. Your virtual friends and your real life friends, and they're now all fixed into the virtual life, and it's making the social media a bit crowded than it should. I think parents, especially mine, were getting a bit worried because it's like watching your child rotting at home doing nothing. Looking at this pandemic, it shifted us to virtual life, and not everyone can afford that virtual life. And then there should be extra support.
Students staying in remote parts of the country were cut off from the rest of the world physically and virtually because of poor connectivity.
When the lockdown was introduced, I was at Shalom. I was worried because here at Kezi, there is no network, so it becomes hard for online studies, and there is no electricity. I wasn't able to communicate with my colleges. The network wasn't good for me to study online and to send my assignments and even to attend lectures online. In order for me to access WhatsApp network, I'll climb on the mountain for better network. Then I'll send my assignment to one of my colleges through WhatsApp, then they will submit for me online. During lockdown, I didn't receive more support besides from one of my friends who were submitting my assignments for me. I think what should be done to support students is to put booster here at my double case Shalom, so that there is better network for students.
As national COVID-19 infections increased, students were not spared. We reached out to one of the students who tested positive for COVID-19, and he shares his experience.
My parents stay in South Africa. They are in South Africa in Kulumani, so they called us to come to South Africa as soon as they heard about the lockdown. I had to come back to Zimbabwe for school because I had to write my exams. We were told that you have to follow the COVID regulations, and one of them was to be put into quarantine center and get tested. When I was told that I am COVID positive, I'm positive to the virus, I was in shock, to be honest. And to make matters worse, I wasn't the first to hear the news. I received a call from my cousin sister and telling me that I was told by the doctor that you are positive. And I was like, what? At that moment, only the thought I had in my mind was that I'm going to die, to be honest. Then, fortunately, there was a nurse there, and there was those people from welfare. They came to me, and they started talking with me. They gave me counseling. The funny part is, we were discharged from that quarantine center altogether. Everyone, whether positive, whether negative, everyone was sent home. And as for me, I was now worried. What about my sister? My sister was negative, and I was positive. And we came home in the same car, sharing everything. So I was worried. Since the start of the lockdown, we never saw our parents. Up to now. And it was so hard. Talking through the phone, not seeing each other. We have tried using the Zoom platform, but then, the economy of Zimbabwe, we can't afford the data. So obviously we miss our parents a lot. The distance, and they don't know how I was doing. They were so worried.
Our parents gave us support through the phone, which was like they were here even though they weren't, because they would check up on us like every now and then, supervise how we're drinking the herbs, and self-isolation, and practicing some of the other things, some of the other regulations of COVID-19.
I was in isolation. I was in my own room. They could bring my food and just leave it at the door. But as time goes on, they started to comfort me. Like, no, you're not sick, you're okay. You know, so they really helped me, especially my siblings who were with me. They gave me support. They will give me muzumbani, they will give me ginger. Yeah, because I don't know other herbs that I ate that time, but I ate a lot of herbs.
When my brother, when I got the news that he was positive, that is when I really got the reality of the whole thing, because I got to experience it firsthand, and I was truly scared, and we tried everything that we could to, make sure that we survived through this together. But honestly, when I first got the news, I cried because I thought I was also going to die.
Fortunately, I can say I didn't feel any like being discriminated because I didn't tell any of my friends. The reason why I didn't tell my friends, it was because I didn't want them to panic. To those people who test positive to COVID, I just want to tell them not to panic and to adhere to the regulation, to the steps which they will be given. As a person, I'm now following the regulation more than I was doing before I was tested COVID. I just want to thank the Almighty for being there for me.
When we're slow to react, the effects hit more as compared to when we quickly try to prevent or try to curb what has happened. So then in relation to students, I feel like at least people could have been quarantined. For example, some got the diseases whilst they were at school. But then if these schools had taken this pandemic seriously, then some of those children wouldn't have been infected with the disease and gone out at home and spread it to the older and weaker people in our societies.
In threatening times like that, I think the government ought to assist us with the necessary resources that we need, so that education does not seem to be viewed as a privilege for those who can afford it in times of difficulties, but rather it has to be a right that is accessible to everyone.
Different people are affected differently. However, most young people have uniquely universal challenges and need to be cushioned one way or the other in the fight against COVID-19.